Good morning, everybody. It is Monday here in South Florida, and my name is Elisa DeFalco, and I want to introduce to you our second class, which is the Hollywood Med Spa Style course that we created in 2005. You can find it on CE Broker, and that would be cebroker.com. And it keeps a list of all the courses that we create. So before we get into the course itself, I like to give the inspiration behind the course. Why? Because number one, I sat on the board for the state of Florida as state educator. And I saw many courses that came by us. Some of them were really wonderful and others not so much. And I'm sure you sat through those courses, the ones that keep you on the edge of your seat every minute, and other ones where you're like, where did that come from? Well, I'm going to share with you what I think personally. Number one is, are they the author of original thought? Have they been in the field long enough to teach something? And number two is, are they just creating a class just to have a class? That happens all the time, and all the boards know it, and people can see right through it. I've been doing this work for 23 years. I owned a clinic. I worked for doctors my entire career and surgeons, and I live in South Florida. So that was the inspiration behind this course called the Hollywood Med Spa Style. Back when I looked out online, there was not a single course on manual lymphatic drainage for the courses that I created. Yes, I was lymphedema trained, and I've always appreciated and will give honor to the people that trained me. And I think they did a great job, but that was the only thing that was out there. There was nothing that was specific to my population. And what happened in the year 2000 to many massage therapists was that there was a time where they could bill under a doctor for manual lymphatic drainage. But that changed. And when that changed, many massage therapists lost their work. They weren't allowed to work in hospitals. They still can't today. If they do, that's considered Medicare fraud if they're billing for Medicare under a physician. So that left so many out in the dark. But I was fortunate. I lived in South Florida, in Fort Lauderdale. And that's what I want to share with you, was the inspiration behind the creation of this Hollywood Med Spa Style course. Where did it come from? It came from South Florida and all the surgeries. I even looked up some of my early tweets when people were therapists who were like me, occupational and physical therapists, were looking at me like, she's crazy. Well, guess what? 10 years plus, and they're all doing the same thing. And guess what? When you're the author of original thought, you got more original thoughts. There are more markets for you guys to use your manual lymph drainage, but hold on. You got enough to learn just with this before we take you to the master level. So I took my time, developed my classes, worked with the boards, and wanted to work with plastic surgery. My first encounter with a European surgeon was one that called me asking for MLD for his clinic in Tampa. I was actually on the East Coast in Fort Lauderdale. He was on the West Coast in Tampa. He asked me to come and he asked me to work on him. And it turned out he had a right leg that was twice the size of the left. Well, that happens with surgeons who stand on their feet and they do certain procedures using certain equipment. So we did one MLD session, and in one day, it was all eradicated. He called me back and he says, I knew you were doing the MLD that you were taught from Europe. And I said, well, I was taught from Europe, even though the Europeans were here in Florida. And I was fortunate to work for the doctor who opened up the first clinics in the United States. I owned one of the clinics and I worked with these European doctors in South Florida. And for them, MLD is a pre and post-op event. It's not even a question. So I'm sharing with you some knowledge I hope that will help you wherever you go for MLD, for plastic surgery, what it is and what it's not. So we began to work and we had great success doing the MLD, and we still work together today. And we do have the master program ready to roll out for you guys on plastic surgery, lymphatic drainage. But you have to begin with step number one in understanding what pre-op MLD is versus post-op. Everyone wants to do post-op. Can I please, please, please tell you, do not take the garments off the patient unless the doctor has given you approval to do so. This is not a lymphedema treatment. These garments are not the same. The garments that these individuals are wearing have a different amount of compression, medical compression, and it's also designed to help them to coagulate and so that they don't bleed out. If you take that garment off of them too soon and they had too many procedures, they could bleed out right through their sutures. So doctors want us to know that please ask them if it's okay and when it's okay, because post-op, we're often working right over the garments, and people freaked out in my class, like, why are you working on garments? You're not working on the skin. That's the reason why. That's why you have continuing education. And that's why when you're working with plastic surgery, you work with a plastic surgeon, putting the information in your class so that you know for sure that you're doing the right thing. And that's also the reason why you want pre-op. A lot of people don't even focus on pre-op. Pre-op is your opportunity to work skin to skin with your client before they're cut on, before they have sutures, before they have drains, before they're wearing compression garments. And it helps to clean out their body system and help the healthy lymphocytes to fight and to rebuild the tissues, and you get a better result. If you don't know what I'm talking about, visit us on mldinstitute.com. A matter of fact, what we'll do for just a moment here is bring you to our MLD Institute International pages. We are on Instagram, we are on LinkedIn, we're on Twitter, and we're on Facebook. And if you go on Facebook, you'll see all the photos from our students and all the work they're doing. The before and afters are amazing. So that's why pre and post-op are important. And that's why you need a class that explains both in detail. Because right now, there's been a lot of talk in the community about what manual lymph drainage is. that is very hard, that is very aggressive. And maybe in some countries, it's like that. Y yo hablo español. I speak Spanish because my husband's from Colombia. And I do know how they do things there. And that's a different type of lymphatic drainage. It's called drenaje linfático. That is not manual lymph drainage that is done in the United States under our scope of practice. We do not pull out drains. We do not shove Q-tips into open holes. We do not remove sutures. Unless that's in your scope of practice, as a nurse or something of that nature, it's not in scope of practice. So we want to make sure when we teach this Hollywood Med Spa style class that everyone's very clear about what we teach, the anatomy, the physiology, the history, the pathophysiology, the indications, contraindications, and also what the outcomes would look like if you're doing it correctly and staying within the scope of practice. And here in Florida, by the way, guys, I have a whole book that I can write for you on all the stuff that we see, because unfortunately, as much as I love Miami and South Florida, I've been here for 25 years of my life. It's the capital of plastic surgery fraud. The FBI has knocked down many doors on plastic surgery fraud down here. And I know about it because my husband tells me about it, and we hear everything. And that's why you're having problems from state to state, and why many of you, even though you've had classes elsewhere, you call us. It's why your boards from all around the country have called us. Yes, we're familiar with this and we know what's going on. And recently also, just to drive the point home, there was a situation that I was aware of 7 years ago where a therapist that I knew did not want to take a class. And I'm not pushing my classes. You can take someone else's classes and they may have some good information, but she didn't want to do that. She put all her pictures up online with bleeding and blood coming out of these holes, and it was just seeping down their legs. And I got to tell you, that's biohazardous material. The minute I saw that, I said, this girl is going to be in trouble. And someone called me and told me, did you see that? I said, I saw it. And I said, I'm not going to be the one to blow the whistle, because someone else will. Because what's going to happen is it's going to cause infection. It's going to cause scar tissue, fibrosis, and seromas. And this person will wind up in a hospital. And what's going to happen is our insurance is not going to cover us as therapists when we work out of scope of practice. So what's in scope in another country may not be in scope in this country. So we need to be aware of these changes, especially when people are flying and they're learning one thing about lymph drainage in one country and another here. So what happened? The Surgeon General stepped in the state of Florida, and there were licenses that were pulled. One of the licenses were pulled was from a whistleblower that was one of my students, because she was sick and tired of seeing all these patients saying, go harder, go deeper. Do you know that someone in the Dominican Republic that had that done actually died from manual lymph drainage? That's not the kind of MLD that you're going to learn here. The MLD that we teach is a very gentle technique. It is a method that's been used and employed in Europe for 100 years, safely with 100 years of research. I do not see that with this variant technique of drenaje linfático going on in South Florida. So we want to make sure you learn the right thing. You're going to feel confident. Your clients are going to feel confident in your hands. That is why this course, the Hollywood Med Spa Style, was created all the way back in 2005 and 2006, right on the brink, to bring MLD into the plastic surgery realm. And last thing that might make you happy is this is not Medicare driven. So it's not CDP, it's not complete decongestive physiotherapy. It's not that. It is a technique that you can bill for. This is cash paying. So you can build a practice around a cash paying modality that you can do for a long time and is gentle to your hands and gentle for your clients. And I can tell you this, if you want clients, don't hurt them. If you don't hurt them, they tend to come back. And when they see results in just a couple of days, I tell you what, that's why I don't advertise. I don't advertise. I don't even update my website. I don't need to. I've been doing this long enough, and I only work the Boca area now. So we have many more people to introduce you to in this world of manual lymph drainage who made it what it is. So my kudos to all my instructors out there. They are really the heroes going out all around the country and all around the world sharing manual lymph drainage. And we hope you'll be one of those too. So our number is 954-709-0042. Our email is lymphdoctors, lymphdoctors @gmail.com. Come to us at our trademarked classes, and you too will learn the fine art of manual lymph drainage with 23 years experience behind it. Have a great day, you all. I hope this helped you.